Good morning, everyone, and welcome to this webinar from Skyresponse together with our ecosystem partners Whzan and Genus, where Keith and Stephen will present their solutions towards you as a potential partner customer using Skyresponse. As always, we're having attendees coming in, so we'll give it a minute or two before handing over to Keith. But in the meantime, I will do just a very short presentation on what our ecosystem partner program is. So basically, from Skyresponse and the ecosystem program is a way for us to continue to be relevant on the market and bringing in new technologies to our partners and their customers. And we have been working with the ecosystem for basically since the beginning of Skyresponse, because we believe that together we will be able to provide better solutions for the service users. Our ecosystem program today has everything from devices to solutions and platforms and products, and covers pretty much anything from alarm monitoring to vital signs monitoring, and everything in between, basically. So that's pretty much everything I will say today. Before we start, I would like to encourage you all to ask questions in the FAQ or Q&A or in the chat, and we will look into them by the end of the session, since we have only around 30 minutes. So very warm welcome to Keith and Stephen, and over to you, Keith.
Thank you, Anders. So, can you all see my screen? Does it come through?
Yes.
Yep. So I'm Keith Chessel. I'm the CEO of a company called Solcom Limited, based in the UK. We have a digital health product we call Whzan, and I'm just going to take you through a very short presentation of that product. So with Whzan, we've got 3 primary feeds of data into a cloud dashboard. The first, our main product is a blue box. It's got a tablet PC in it, as you can see. It's got Bluetooth instrumentation, and there's a wide range of instrumentation available. And it's deployed across England in care homes where care workers monitor the residents, and it's deployed in virtual wards where people monitor themselves. We have an app which we can configure the content for each patient, and that app also can feed into our cloud dashboard. The app and the tablet can run assessments on patients, and everything works in real time over either 5G, 4G or Wi-Fi. And finally, we have a range of activity sensors, so we can monitor someone in the home. And I'm going to talk a little bit about each one. The cloud dashboard is a triaging dashboard, so it sorts patients out or users out by health priority. It's interoperable with the UK patient record systems and with the 111 system. So we distribute the data across our NHS, and it's also interoperable with Skyresponse. It can generate events in Skyresponse that have been created through either a vital sign or an assessment score. So I'll take you through the components now. So the blue box here, we're using it for virtual wards, all types of virtual wards where patients get the box for a short period of time. They do their own home monitoring. We've got a wide range of equipment ranging from blood testers, point of care blood testers, through to a 12-lead ECG with an AI engine to do the diagnosis. We've got a wide range of health assessments as well. So from the dashboard, you'd configure up the box in terms of what instruments you'd need to add with it and what tests and assessments you want the patient to do. The patient would get reminded to do these tests. They pick up the instrumentation, put them on their finger on their arm, and then the instrument Bluetooth into the tablet, which speaks the readings out to the patient, so they know that's been done, sends it up to the cloud, and if they fail alert level tests, they will go on to Skyresponse. Similarly, the app will do the same sort of thing. We've got a wide range of content for the app for multiple disease types, the big selection of assessments, and users can put their vital signs in through the app as well. The app can be used with family and friends, and we can display any type of data, health or activity or environmental data about a patient's home. Our activity monitoring is like many others, it's IoT or it's LoRaWAN. So we have a deployment of LoRaWAN in the social care setting environment, and effectively we have our app is used as a family and friends sharing tool. So here's a bit more about the clinical side of things. The dashboard, as you see, can be sorted. Well, it is sorted by health priority. It's designed for multi-user teams of clinical people to look at the data and record notes and effectively prioritize who they're going to see and what they're going to do. There's multiple views of the data lists depending on what configuration the blue box has been made. So, for example, we've got systems for monitoring those with mental health issues. We've got systems monitoring frailty, care homes, oncology, just a wide range of dashboards available, which get automatically selected depending on its use. And then we've got screens for sharing that data, allowing clinicians to say they've dealt with a problem at an alert level, and we've got individual views on time series of graphs. To send a data alert to Skyresponse, it's very simple. So for the patient, you mark their identifier, and then you choose which limits you want to go to Skyresponse. And if the incoming data breaches those limits, then we generate an event in the Skyresponse system. So it's all very straightforward and simple to use. And then last slide. These are some of the successes we've had across the UK, both in care homes and in virtual wards. And you can see, really quite substantial reductions in demand on the health service. And they are borne out through multiple areas across the UK. Okay, I think we've done that rather quickly, so that's me done.
Thank you very much, Keith.
Thank you, Anders.
We'll wait with the questions until the end, and then we'll basically welcome Stephen into the discussion as well.
So are there any questions, or shall I just start?
I think you can go ahead. No questions at the moment.
Cool, excellent. So hello, everybody. I'm Stephen Wesley from Iris IoT. We are the Genus Care partner for the UK. Bit of background, I've been in telecoms for over 30 years, and we look at innovation, try to predict what's going to be next using the latest technology, and also look for gaps in the market. So the assisted living care market, obviously it's a massive transition at the moment from analog over to digital, and where it's going to be in the future is incredible. So we scoured the world to find what was going on, and we came across a Dutch company called Genus Care, who had a product, and we do a lot of collaboration, so we don't try and own everything. We strongly believe in working together with different partners, and Genus had the same ethos as ourselves, which was to build better products, better solutions. More importantly, to actually listen to what the clients needed. So the people we were delivering the solutions to, what kind of product they need. So I've not got a demonstration as a PowerPoint. I'm actually going to do a live demonstration of the kit. So fingers crossed, these never go well. So this is the Genus frame itself. So there's quite a lot of sensors built into the digital frame. So we have temperature, humidity, light, noise. It even registers every time somebody touches the screen. We have a built-in video camera, and on the back of the device there is a radar and some more in-depth air quality sensors as well. So for the device, it runs on 4G as a SIM. There is an option to have built in already. There is an eSIM, so we'd probably select that from a different provider for resilience. Then it also uses Wi-Fi. Then it also uses hard internet as well. So you've got 4 types of connectivity. The device comes with a 10,000 milliamp backup battery, so that should last around 12 to 15 hours if there's a power loss from the device. And in the back end of the device, you can also set up alerts. So if we was to take the power out for a short time, we get a notification. That would not go through to the platform because it's not critical. So in the Genus platform, you can set the thresholds of when you're going to be alerted of an emergency when it gets down to a critical, say 20 or 30%. So that's the device itself. What we've also done is looked at how the sector is addressing the current digital changeover, and of course the first phase is to replace the pendant or the panic button. So on the device there is an SOS button, but we can also add off-the-shelf Bluetooth buttons. So these can be placed around the home. So you could literally flood a place with 20 different low-power Bluetooth buttons to raise an alert. So you don't have to physically be with the device. We've also added GPS tracking. So GPS tracking device, which does exactly the same as the home button, but the difference being it does send the location as well if an alert has been raised, and the GPS location has got 2-way audio in as well. One of the other things we've done is have different levels of when alerts happen, how they are responded to. So traditionally, when a pendant or an SOS is raised, it goes straight through to the ARC, the Alarm Response Center. But what we've done is we've actually put a buffer. So friends and family, if the client, the user, does have friends and family available to them through an app, through the Genus app, will get a notification to say somebody's raised an alarm. In the back end of that platform, you can set a time amount of when it's going to be pushed to the second level and push that through to the ARC. So, for example, if you've got 20 friends and families, you might want to give them 2 or 3 minutes to respond at a local level. But if that didn't happen, then it'd get escalated into the ARC through Skyresponse. So simple button, what it does is you press the alert, that will then call all your contacts to let them know that you have requested. There we go. So it comes up that an alert has been raised. And in that notification, you can then let everybody know if you're able to respond. If you're not able to respond, what will happen is we will all get notification that nobody's responded, and it will go through to the ARC. If somebody is able to take action, then we'd all get notification of who's taken responsibility. More important, the end user of the frame will also get that an alert as well, so they know who is coming to help them. And for compliance, that's held in the cloud, so you can go back and see who took ownership of that. If the call was to go through to Skyresponse, so I'll quickly share my screen here. Bear me a second. Here we go. So on the Skyresponse, this is the frame that you would get to see. And if an alert was to come in, what will happen is, first of all, it'd go through to all the friends and family. but then within a couple of seconds, if you've set it, there you can see on the left-hand side, we've got an alert come in. And then from that, as soon as you take ownership of the alert, screen pops up to show you if you want to make a call into the frame. So if I start a video call there, what will happen is it'll initiate the call to the end user. That end user will then their video will pop up so they can see who they're talking to. We can have whoops. That's a call from Jill from Genus, who's in China at the moment. So he's just got my alert and he's responded to that. But at the end of the call, Stuart didn't accept it. But once you've closed it down, there would then be a notification of you being able to take action of why you had that call and what the outcome of that call was as well. So that's a very brief overview. I can talk for hours about Genus, where we're going. Any questions? Silence, that's good.
Yeah, so far no question has been raised. Giving it a minute. In the meantime, Keith, just to bring you in again. Can you? I mean, you showed in your slides in the end on the users, but what would you say is the overall feedback from patients using the blue box, for example? What kind of feedback do you get?
So the two uses are either from an individual using it themselves, and the NHS have made lots of videos of them using it in virtual wards, and that elderly patients who are not technically able or don't have a smart device themselves find it very easy to use the equipment, and that's kind of the overriding message there, because they literally pick up the instrument, put it on their arm or their finger, or put it in their ear, press a button, and then that whole system then takes over. The Bluetooth reading comes in, they get the announcement. And then with care homes, we're in about 3,000 care homes in the UK, the carers find it empowers them to provide a better level of care. So these would be, the users would be clinically untrained, just simple social care workers. They have a patient or a resident that may be slightly unwell. They might think they're unwell. They would normally be too nervous to call a GP or the NHS services straight away. So they'd normally wait for a disease or infection to develop before they actually call GP. With the blue box, they can take the vital signs. There's an algorithm called the National Early Warning Score that we use in the UK. They get a simple number between 1 and 10. That number's shown on an amber or red background. If it's amber or red, they know they've got to get help. So it really helps them get help early, and it's all about early intervention, early antibiotics. That saves the hospital visit and it saves the stay in hospital. Thank you.
Thank you. Question for you, Stephen, from Bradford. So on the frame, basically Genus frame, can you do communications like medical reminders or other kind of or the usage with the tablet, basically for the service user, etc.?
Yeah, there's two different levels. So friends and family who have access to the app are able to push photos through with text messages, so they can make a personalized message. And this was quite important in acceptance of Genus frame in testing. So in Holland, they did a trial of 100 users aged over 75 years old, and they had a 93% acceptance of the technology, which was quite important. There's no good how good you make your devices. If they're not getting used daily, then there's no point from them. But at a higher level, from a local authority or care perspective, you can also push through to the frame reminders. So they could be social reminders like doctor's appointments, or don't forget there's a bingo event tonight if it's a care home. But more importantly, it can be medical reminders. So this is my Jill. I don't know if you can see that, Jill in the is sending me through messages. You know, are you okay? So that okay can be a yes or a no. If I respond to that, then that will then be sent to the portal. But for the medicine reminders, you can put in dosage. You can put how often that dosages need to be taken. You can attach a picture so they know what the pill looks like, or the packet. And again, what will happen is that is sent through to the frame, and that reminder will be you can set how often you want a reminder. And until you get a response to say, yes, I have taken my medicine, that person will get an audio and a visual reminder to take that medicine. So that's quite important, I think, a feature on medicine reminders for the end user.
Cool, thank you. I got a question from Kevin asking about the Bluetooth button can that be associated with specific locations so a respondent might know where the individual is? I'm not sure if that one is for the Genus frame or for the Whzan, but whoever is up for grabs, basically.
You go, Keith, first.
Sorry, Stephen, I think that's one for you, isn't it?
Oh, okay. So yeah, so that they can be tagged. So you can put up. It's low power Bluetooth as well. So I don't know if people know the difference between Bluetooth and low power Bluetooth, but it means we can have multiple devices. But it's a greater range as well. But yeah, they can be tagged like kitchen, bathroom, where that event has happened. Obviously, with the GPS tracker, the GPS is given a live location. One of the features which is quite good about that is it's live tracking. So to get the most out the battery, which lasts about 7 to 10 days on standby, but the second you activate I need assistance, that goes into a real-time tracking, because you want that data. You don't want it in 5 minutes time or 10 minutes time. So it's real time. And because we're in 2024 and we're all used to, Google Maps, it shows you the best route to that person. So yeah, that's quite a nice feature on it.
Cool. Are your products on the assessed solution list in Scotland? Are you aware of that?
I can find out. I know we're currently through partners, we're on quite a lot of different platforms, but I can find out, Kevin, if we're on that one, and come back to you.
Yep. And then we got a question from Gareth for both of you, and a little bit maybe from our end as well on the Skyresponse side. But what are the criteria for linking through to the Skyresponse platform versus handling events locally? Is any data transferred to the platform, or is it simply an alert notification? And do the Skyresponse platform have any access to the underlying data?
Do you want to go first, Keith, or do you want me to?
Okay, I'll go first. So we generate a simple alert, but we can actually also supply systems with a link which would allow someone to view that patient data on our system. So effectively, both levels of detail are there. But normally it's simple alerts just to say someone's got high blood pressure, or they've got a high national early warning score. That would generate alert into the ARC, and then the people that would have access to our system. And we've got multiple login methods. So for the UK, anyone in the NHS can log in with their own identity and credentials. Stephen?
Yeah, so from ours, it is escalated. So the Genus Care does have its own platform where the escalation into Skyresponse can be set by the individual down to an individual level of how quickly it needs to be escalated, because we've got that extra level of friends and family. And the data that the responder can see can be tiered as well. So again, it depends on an individual basis on how much insights they want. obviously moving forward in the future, we do understand it is a work in progress, that we want more and more features to be added, more and more insights, so the responder can have a greater overview of somebody's general well-being. You know, it's not just about the alert, it is why has the alert has happened. But yeah, that is definitely something we're going to work closely with Skyresponse with to make sure we can provide as much data as needed.
Yeah, great. And from a Skyresponse perspective, basically the integration support on our end is open in that way. So both Whzan and Genus could basically decide what kind of information they would like to send together with the alert. And like Keith mentioned, it could be a link together with the alert. So once the respondent receive the alert, they will be able to have the experience of almost like a single sign-on, clicking the link being sent to the Whzan platform, and likewise on the Genus Care if they would like to provide that information. The video call, of course, that Stephen showed you is integrated, so you as an operator in the ARC will be able to have an established video call from the desktop using the user interface on the Skyresponse side and having the communication, etc., etc.
Yeah.
Got some more questions coming in. Information around costs is frequently asked. Where do they actually find out how to purchase and the cost for the products, and also if there are any additional costs on the software side on your end as well, in terms of if you buy a Whzan unit or Genus Care frame, will there be both a hardware and license cost, for example?
So
yeah. Go on then.
okay, so we have a very simple pricing model. There's a purchase price for the blue box, and the standard price for it, as you saw on my presentation, is £600, and then there's a annual fee of £400 to use the system, and that covers unlimited numbers of patients and unlimited numbers of users, technical support, training, and updates.
Yeah, and from the Genus point of view, it's a tiered model, and the reason being, we also looking at the opportunity of this going into the B2C sector. So we've tiered it with price of the hardware as one, which is a one-off cost, and then the flexibility of how long you actually want to subscribe to the platform, whether it's 1, 2, 3, or 5 years. So we kind of bespoke the model for what the project is and who's going to be using it. But it is tiered, and we start off with just the app, and then the app and the Genus platform, and then the app and the Genus platform, and then the Skyresponse. So and then the alerting, who's actually going to manage the alert, the calls as well. So we tend to build every project to the specification of what is needed for the client. It's not a one solution fits all. It really is bespoke for us at the moment.
Thank you. We have 2 minutes left, so a couple of more questions. I got one for you, Stephen, regarding the tracking inside and how you actually connect. Are you connecting to Wi-Fi and tracking the individual, basically, like we talked about previously? So is it the Wi-Fi connection, or how do you do the tracking indoors, so to speak?
Yeah, so we're also, so for the GPS tracker, then obviously that's 4G, so it's 4G, and it also uses Wi-Fi when it's at home as well. We're now also linking it into the actual Genus frame, so we know how close it is to the Genus frame as well. But we are adding other features. So we've just added our own 5-in-1 sensor, which is temperature, humidity, PIR, so we can give a better overall view of people's movement behavior as well. So we've got a whole raft of innovation, and it's not all our products. You know, a lot of these are off the shelf that we've integrated. You can't develop everything, but you know, that kind of movement patterns give you a really good overview of somebody's behavior. So we're now looking at Wave for fall monitoring, which is a fairly new technology to the sector, but it gives a great insight into falls, but also monitoring falls really precisely. So we're talking even for slow falls, it'll pick up to 95%. But the other thing that technology does is it can do room occupancy, but also how many people are in that room, where a simple PIR can only say if somebody's in a room or not. The wave can actually tell you how many people in the room. But the idea is we don't want to overcost and people to pay for more than what they need. So it's a case of, yeah, the Genus is the heart. That is where we're going. All the data is being pushed through Genus one way or another, but it's about building the solution for what the client actually needs.
Thank you very much. So we're at 31. There are a couple of more questions. We can go through them if you have time, or yeah, those who have a minute, please continue in the meeting. Otherwise, you will be able to have a look at the recording after the meeting as well. So there's a couple of more questions, and this one is also for you, Stephen, regarding data and what data you will actually be able to see in the Genus portal regarding to the frame, etc.
Yeah, so all the sensors are obviously creating data, but you don't want an information overload. So, for example, the PIR sensor is very clever. So, if as it's quite a nice looking piece of kit, you know, it's something you probably would more than likely have in the heart of the home, so in the lounge. And what it does is every time somebody first of all comes into that area that day, it begins to learn their behavior pattern. So if they wake up at 8, 8:15, 8:45, that kind of time, nobody wants a notification because that's, you know, normal behavior. But in the back end of the portal, you can actually set your alert into when you want to be notified as an abnormal behavior. So that could be 2 hours out of a normal. And what it does, over the time, the more data it gathers, the better the data is, because it's had more insights of that user's behavior. So we would all get an alert. So everybody connected to the frame would get an alert after, say, 2 hours if that person hadn't got out of bed. So very simple technology, but it's quite a good insight. But if anybody wants a demonstration of the back-end portal, more than happy to go in depth. But yeah, we need another half hour at least to show you all the features of how you can control the device from the back-end portal.
Thank you very much. And one for you, Keith, before we try to wrap up. Just from my perspective, how long have the Whzan Blue Box and the platform been around the UK now?
Okay, so Whzan was developed actually for industrial solutions in 2007, and then we started our health journey in 2010. So our first patients with Blue Box were 2010, and they had long-term conditions, COPD and heart failure. And it's progressed on from there. Really, the big change came in 2016 when we allowed the box to be multi-patient, and that enabled its use in care homes. Which are now virtual wards, and domiciliary care users are taking their kit around from patient to patient.
Okay. Very warm thank you to both Stephen and Keith for joining us in this webinar. Like mentioned in the beginning, it's recorded, and we will put it up on the Skyresponse website for anyone who would like to revisit it and have a look at it again. If you have any further questions, feel free to reach out both to us at Skyresponse, but also Stephen and Keith, of course. And if you might have trouble finding them, let us know, and we will put you together in contact with them. And yeah, I think that's it. So thank you very much.
Thank you,
Thank you,
everybody.
Anders.